Hi there, my name is Steve Aoki. I'm orthopedics at the University of Utah. I just wanted to spend this time to go over what to expect after hip arthroscopy for femoroacetabular impingement in my practice. Now, just as a quick summary of the process, femoroacetabular impingement is a mismatch between the shape of the ball and the socket of the hip joint. This causes, with range of motion, a abutment and mechanical pinching in the joint, which in turn can lead to pain. With the surgery, we enter the joint using the microscope. One of the first goals of the surgery is to address the labral tear. The labrum is a soft tissue structure that surrounds the hip joint that helps add stability. On the left, you can see the labral tear, and on the right picture, you can see the labrum after we're done repairing it. Now, the second main goal of the surgery is to essentially reshape the joint. On the left picture, you can see the typical cam lesion, which is the area of the ball of the joint that is not round. And after the reshaping, we've rounded out that area so that the ball fits better in the socket of the joint. I wanted to take a little bit of time to address a couple issues that we can work on as patients in order to try to maximize our chance of improving after a surgery. It is well established that the healthier you are, the better you'll do with a surgical procedure and the better outcome you'll have with the procedure itself. So there's no better time to start thinking about lifestyle changes than now. Consistent exercise is important. If you look at individuals that exercise consistently, they just feel better. They have less pain complaints. It's really important to maintain that level of activity in a way that works for your body, as it will help you get through that surgical procedure effectively. Nutrition is really important before and after a surgery. If you look at our bodies, we're really no different than our car. You have to have the right fuels in order to get your car to run efficiently. Just like our car, we need to have the right fuels. Healthier, fresher foods are better than the processed and fried foods. Maintaining good sleep habits and hygiene is really important to the overall recovery process, particularly right after a surgery. It's important because this is the time when your body is trying to recover. One of the often overlooked areas of our overall well-being, particularly after a procedure, is your overall mental health. If you look at anxiety, stress, and depression, they all amplify pain and they all negatively affect the healing process. If you look at patients who have poorly managed mental health, they tend to have worse outcomes with any surgery. So it's really important to not disregard this aspect of your overall care. For this next section, I'm going to focus on your surgical day and the overall recovery process. Hip arthroscopy for femoroacetabular impingement is an outpatient procedure, meaning you go home the same day after surgery. The surgical time is approximately 2 hours of time. The surgery itself is performed using the microscope. We do 3 incisions about the size of a button shirt hole in your shirt. While the surgical time is relatively consistent, I would anticipate that you commit about a half day to this entire process. Surgical time in the hospital can be quite variable depending on when you actually get your surgery started, the time within the surgery, and then also the time in the recovery room can be variable. Now, after you're ready to go home after the surgery, just be aware, if you're traveling by car, you cannot drive home by yourself. You need to have someone that is available to drive you. Really, any position that you feel comfortable sitting or reclining, I just want you to be able to position in the car in a comfortable manner. Just be aware that if you're driving home, it may be good to come in a larger car so that you have more space to spread out. If you are traveling long distances by car, I think most of my patients tend to prefer to drive home the same day. You may want to stop every couple of hours just to reposition and mobilize a little bit for comfort. As you're traveling, just move your feet and pump your feet back and forth to help keep blood circulating. And if you decide as you're going on your way home if you feel like you don't feel well enough to make it the full distance home, go ahead and stop and get a hotel. If you're traveling by plane, you may fly back the next day or later, but I have no problems with you traveling the next day. Just make sure that if you're heading to the airport, go there early to allow for a slower check-in process and to get the appropriate people to help you get to your gate. Ask for wheelchair assistance, and then you may want to take a baby aspirin on the day of travel if flying within the first month after a surgery like this, just to help minimize blood clots. Now, eating after surgery, while I'm really okay with you eating anything that you crave, because that's typically a good sign that you are going to tolerate it, I would recommend that you start with something easy. Usually in the recovery room, the nurses will start with clear liquids and gradually increase you to bland foods. But once you get home, if you're craving something, it's okay to eat it as long as you can hold it down. I would consider using this time after a surgery to start thinking about ways to improve your nutrition. After surgery, I prescribe 3 medications typically. I'll do a anti-inflammatory, a narcotic pain medication, and something for nausea. Now, of the 3 medications that I prescribe, there's really only one that I need you to take, which is the anti-inflammatory, which is typically naproxen. I have you take it twice a day, so once in the morning, once in the evening, for a full 2 weeks, and then you can take it as needed for pain control after the 2-week scheduled time period. While it's a good pain reliever, the main reason I give it to you is that it helps keep you from forming extra bone around areas around the hip where I don't want bone to form, like in the x-ray down in the bottom left-hand corner. There's really only certain circumstances where you won't be prescribed an anti-inflammatory with allergies, intolerance to the medication, history of ulcers, gastric surgery, or kidney disease. Please let me know if you have any of these prior to. If you do have problems with the naproxen, call us. We can switch it to a different medication. It's just more expensive. I personally don't routinely prescribe blood clot prevention medication after a surgery for hip arthroscopy, given the low risk. Although I would recommend that you mobilize early. The more that you can get up, move around early, the less likely you are to have a problem with a blood clot. The only time that I do prescribe prophylactic medication for blood clots is if you had a previous personal history of a blood clot in the past, or if you have a strong family history. In those cases, I'll give a blood thinner for approximately 5 days. During this time, while you're on a blood thinner, I would want you to hold off on the anti-inflammatory medication, but start that regimen as soon as the blood thinner is done. Pain control and what to expect after a surgery is probably one of the most common questions that we get from patients. I will write a small prescription for opioid pain medications. These are the medications that I really want you to be safe with. They're the ones that have the dangerous side effects. There's the issues related to addiction and dependence. And then also, if you take too much, it can decrease your breathing. Those are the dangerous side effects. That's where people get into trouble. The more common side effects are constipation, nausea, mood changes, dizziness, itching, and it may even slow down the healing process. So there's good literature to support that it slows down soft tissue and bony healing. So the faster I can get these out of your system, the better it is for your hip and the overall recovery process. My goal in general is to try not to use these medications longer than the first couple of days after a surgery. There are safer ways to control pain after a surgery. Try not to take these medications to be pain-free. I expect a little bit of achiness. There's great data to support that taking a combination therapy of a prescription strength anti-inflammatory, which I'll write for after the surgery, as well as taking acetaminophen, which you can get at the pharmacy or the grocery store. Taking those two in combination has been shown to be as effective as an opioid medication without all the dangerous side effects. Ice therapy is a good way of dealing with some of the throbbing discomfort that you'll experience after the surgery. There's easy ways to do this where you can get ice packs from your local sporting goods store. There are more elaborate ways of icing where you can purchase or rent an ice machine, which it's a little bit more efficient. You can hook it up and it usually powers ice water through the machine so that you don't have to change it so often. I've included our local representative's number here if you would like to call them to discuss options before the surgery. You can also buy these off of the internet. Typically, while there's no magic number as far as how often to ice, most people tell you 30 minutes on and then take a break for 30 minutes. Really, if you adjust the amount of clothing between you and the ice machine, it should be cool. It shouldn't be cold to a point where it's uncomfortable. If you can adjust the amount of clothing between you and the ice machine, you can run it for a long period of time, and it's quite safe. As soon as I'm done with the surgery, I'll put a needle directly over the area where I've worked, and I'll put some numbing medication, which does help with some of the pain control after the surgery. I don't do a formal nerve block, but we've shown that this is an effective way of controlling pain, and it's very cost effective as well. Wound care after a hip arthroscopy is relatively easy. There are 3 portals. You can get some drainage from those portals that stain the dressing, but don't be alarmed by this. The dressing that'll be on your hip will be some gauze pads covered by a clear, relatively water-resistant dressing. It's a clear, thin membrane that it's pretty safe to hop into the shower and take a really quick shower and just rinse off. Over the first few days, I just want it to be a quick shower. Keep that plastic dressing on for about 5 days. You can take off the clear drape and the gauze pads after that. So once the gauze does come off, after you've removed the dressing, there'll be steri strips on the skin. Those steri strips are those stickers. Leave those in place. Let them sort of unravel on their own. It can get wet in the shower after you take off the gauze, and so go ahead and take a normal shower at that point, but don't submerge for about 3 to 4 weeks in a bathtub, hot tub, or pool until those incisions have fully healed. The sutures in the skin, underneath the skin, are dissolvable, and so there's nothing that we need to pull out. They'll absorb in the body, except for in certain specific cases where, say, you've had a previous surgery and you've reacted to the dissolvable stitches, and so we have to use something that's more permanent, then those do need to come out. After the surgery, I do want you using crutches for approximately 4 weeks. When you first start walking with the crutches, you're going to be toe-touch weight bearing, where you'll have that toe balancing on the ground, putting most of the weight through your crutches, but putting comfortable weight through the tip of your toe. I'd rather have that toe on the ground than to have you non-weight bearing with a foot off the ground, because if those crutches do slip, I want that foot on the ground to help support yourself so that you don't fall. After the first couple of weeks, if you feel comfortable enough, you can switch over to flat foot walking, where you're going more heel to toe with a normal stride. From a driving standpoint, I anticipate it's going to be about 2 to 6 weeks after the surgery before you're going to feel ready and comfortable to drive. I have a couple criteria as far as what I want you to pay attention to. Number 1, I need you off of narcotic pain medication, because that's driving under the influence. And from a safety standpoint, you need to be able to work the pedals. So you need to be able to sit in the driver's seat, go back and forth between the brake and gas, and feel like you have that reaction time down. But you need to, from a standpoint of safety, you need to be able to press on the brake and be able to generate enough power where that feels comfortable. Typically, the return to driving is slower for right hips compared to left hips, especially given automatic cars. But if you're driving a manual, you may want to consider switching cars with someone. After the surgery and your paperwork, you will go home with a prescription for physical therapy that has our full protocol on there. I typically like to start formal physical therapy about 2 weeks after the surgery. From a frequency standpoint, it really depends on your needs as a patient. I have patients that go 3 times a week. I have patients that go once every couple of weeks. I think what I would like you to do is adjust according to your needs and your social situation. I want those visits with the physical therapist to be productive, and I want them to be helpful. I don't want physical therapy ever to be a financial or time burden for you. And certainly the fluctuation between physical therapy, there might be some times when you feel like you can space those visits out, and other times you feel like you can get a little bit more out of the physical therapy visits, and you may want to do it more frequently. But I would have you adjust it and do the physical therapy with your therapist, but try to fill in those gaps in between your visits at home. Try to get into a normal routine of trying to do something every day. From the standpoint of returning to work, I do request that you please send us all of your paperwork needed for your work release prior to the surgical day. It certainly makes it easier for my staff to be able to accommodate and get your paperwork in on time. From the standpoint of work duties, it's usually up to 0 to 2 weeks where I anticipate being able to tolerate desk work or light duty if you're allowed to use crutches at work. It's typically about 4 weeks before you can do light duty without crutches, and about 3 months before you'll start tolerating more heavy labor. Now, from the standpoint of school, I typically target about 7 days out from school, although I've had kids go back after a day or two. You need to be off of narcotics, as the school won't allow you to take narcotic pain medication at school. You need to be able to tolerate the weight-bearing restrictions, and check with your school about accommodations. Check to see if there's an elevator key that's available, and then make sure you check with your teachers and administrators about getting extra time in between classes to travel in the hallways. My typical follow-up appointments after a hip arthroscopy is the first visit is right around the 4-week mark. It's typically either done in person or virtual, depending on your needs. It's typically either seen by myself or one of my team members for the follow-up. Second follow-up will be somewhere between that 4 to 6 month window as we're starting to transition more back into sporty type activities. And then the final follow-up, as long as you're doing well, is at the year mark, where we'll sit down and kind of go through that transition and what to expect from that point on. While the physical therapy prescription that you'll go home with and take to your physical therapist will have more detail, I just wanted to go over the anticipated activity goals and the timeline of what to expect after surgery. For that first month following the surgery, I just want you to get more comfortable with your daily activity. I want things to just start getting more comfortable. You'll begin some gentle strengthening and mobility exercises. There'll be a sheet that you'll go home with that's included with your formal physical therapy prescription that just has some gentle exercises that you can begin prior to your formal therapy. One of the motions that I don't want you to do after a surgery is hyperextend that hip, which is essentially kicking that leg behind your body. When you hyperextend that hip, it puts more stress on the front of the hip where there's this tissue called the capsule that is protective and adds stability to the joint. In order to do the surgery, we go through that tissue, but we put some stitches in that tissue at the end, and so I need to protect those stitches to get that to heal. Between the 4 to 12 week period, that first 3 months of this whole process, you're really focusing on just low impact exercises, stationary biking, walking, swimming. Once you can walk comfortably, you can hop on an elliptical. You may do some extension stretching in order to accommodate for walking only. I don't want aggressive stretching until the 3-month mark. 3 months is my time window to start having you incorporate some light jogging to comfort. Usually when you start a new activity, I always want you to start thinking about starting around 60 to 70% of what you normally do. When you first start an activity, start out easy. When you start jogging, jogging can be a little bit more load to the joint. I don't expect you to tolerate all jogging, but I let you try as long as it's comfortable. At that point, at 3 months, I let you start opening up the stretching. Try to aim for symmetry compared to your other side. Sometimes there can be a little bit of tightness associated to the hip after a surgery, and I want that hip to open up and have as much motion as the other hip. That'll make it feel more normal. At the 4 to 6 month window, that's when we're transitioning back to sport-specific training. Depending on your strength, your comfort, and the type of sport that you're wanting to return to. Sport-specific training is really getting back into the conditioning and strengthening and the movements related to what you like to do competitively. Now, this is a gradual progression. I need you to be able to tolerate sport-specific training and conditioning first. Once you can do that comfortably, then we increase to scrimmaging. Once you're able to scrimmage with your team, then you can, and you're doing that comfortably, then you can start progressing to competitive full return to play. While I lift restrictions at that time, more aggressive sport and repetitive sports may take a longer time to get back to the full activity and where you want to be. After 6 months, there's still room for improvement with continued strengthening and conditioning. Improvement can even be seen up to 2 years out from a surgery. Now, luckily, a surgery like hip arthroscopy is quite low risk as far as concerns and complications after a surgery. Probably one of the more common complaints is skin numbness along the thigh, particularly the outer side of the thigh. There's a nerve that runs close to the incisions, and that nerve can get irritated from the surgical site and can cause some numbness along the outer side of the thigh. Most of the time, that skin numbness does improve. Sometimes it can be permanent. Infections, slow healing incisions, blood clots, those are all very uncommon risks after a surgery like this. Some common issues early after surgery. Some people complain about mechanical clicking and popping. I wouldn't worry about that in the early period. Some people feel a tightness. We'll gradually kind of adjust your therapy according to how tight you feel. And then there can be some soreness as you progress with increasing activity and therapy. So just be aware of that. That is relatively common after a procedure. If you have any further questions or concerns, please feel free to call the office so that we can help you through the surgical process. We want this to be as smooth as possible. Thank you so much for taking the time to watch this video. I hope that it's informative and helps you understand what to expect after the surgery, and we appreciate you trusting us with your care.